First and finest, the Centers for Disease Control and Prevention and World Health Organizations are closely monitoring the outbreak of a novel coronavirus, or COVID-19, that originated in China, which has now caused community spread in the United States. We are closely monitoring the COVID-19 outbreak in the U.S. and its presence in Virginia. Our emergency management protocols are in place with a dedicated team to closely monitor this virus.
In accordance with the CDC guidelines, if you have traveled from an affected area or been exposed to someone with the COVID-19 virus and develop a fever, cough, or difficulty breathing, the recommendation is to seek medical advice by phone. Patients with COVID-19 have had respiratory or breathing symptoms that range from mild to severe. To help prevent the spread of COVID-19 and/or other respiratory illness, NMCP has provided instructions on how to get medical care without exposing others based on your symptoms, exposure, and/or travel history.
Call ahead recommendations. 1. NMCP COVID-19 Call Center. This is a local resource. Please call NMC COVID-19 Call Center at 757-953-6200. This call center is staffed by nurses 24 hours a day, 7 days a week. If you have questions or concerns about your travel and/or exposure history and symptoms. 2. If you're not in the local area, you can call, text, or video chat with the nurse on the nurse advice line. 3. If recommended to go to a medical care facility, please perform the following. Upon arrival, notify the staff that you've been exposed to COVID-19 or have symptoms. Face masks are conveniently located at the hospital and clinic entrances.
Remember to help protect yourself and your family and friends from novel coronavirus or COVID-19. Your personal actions can make a difference. 1. If you're sick, please stay home, except for getting medical care. COVID-19, like other respiratory infections, will usually resolve on its own, though it can become severe in some patients, specifically those with pre-existing or comorbid diseases. Preventing the spread of these infections by staying at home if you have symptoms is very important. 2. If seeking medical care, please call ahead before visiting a healthcare provider. 3. Wear a face mask. 4. Wash your hands with soap and water for at least 20 seconds. Use an alcohol-based sanitizer that contains at least 60% alcohol if soap and water is not available. 5. Cover your cough and sneeze and avoid touching your eyes, nose, and mouth with unwashed hands. 6. Stay away from people who are sick. Social distancing of greater than 6 feet is recommended. 7. Try to avoid close contact with people who are sick or someone who is showing symptoms. 8. If you're 65 and older and live in areas where there is ongoing community spread, you should think about what actions you can take to reduce your exposures. Please review the CDC recommendations in prevention of spread in communities. 9. COVID-19 testing is not usually required unless you are sick enough to be admitted to the hospital or public health authorities require testing. There is specific criteria used for testing of individuals.
If you have any questions or concerns, please do not hesitate to ask. Just call us. Also, refer to the CDC website for the most up-to-date information.